This is Coach Aiet, and welcome to another episode of Coffee House Chat. I am your host and your financial strategy coach. With me is Professor Sai. Good evening, Professor.
Hi, Coach. Good evening. This is Professor Sai of XTP. Shout out loud to everybody, guys. Thank you so much. Welcome to another episode of Coffee House Chat Sunday. This episode or this show is designed for professionals, business people, entrepreneurs, for us to be able to give tips, to give practical advices, and to showcase some of our fellow professionals in the industry that are able to add value to our lives, especially right now, Coach.
Coach. Very timely and relevant ang ating guest today because she's part of the frontline workforce. And before we dive in, I would like to thank everyone because very engaging yung ating mga audience last week. Do you still remember, Prof. Sai?
Maraming salamat, Coach. Especially for, would you like to recap lang yung last week natin?
Yes. If you can show the picture with Miss Alu Santos, we would like to say hi and I hope you're doing well. We miss you and thank you for gracing the event last week. We also have a few shout-outs, di ba?
Okay. Meron tayong surprise, Coach. Shout-out lang to some of those who watched and listened to our show last time. So, shout-out kay Jen De Ramos, okay, to Albert Paradela de la Torre, parang kamag-anak ko ata to. Oo nga, de la Torre din, di ba? So, I assume, magagaling to, tsaka masasipan. Kay Maria Isabel Hermoso Clavel, yan. And of course, kay Rexy Libao Bernal. Guys, congratulations. Bagong segment because of the comments nila, Coach, they won a load or a Gcash.
Wow!
Yeah, di ba?
Feeling generous naman tayo ngayon, ha?
Siyempre, Coach, para to be able to help yung mga listeners natin and those who are watching. Coach, ano pala? How about yung mga events natin? Ano ba? Kamusta ba yung how's your week pala?
My week was very productive and I am happy to inform everyone that there are three events that I joined this week. And the very first would be from Go-Chu, that's Mentor Online Live. So I was part of the mentors that was featured last Wednesday. And those are the feedback. Nakikita nyo ba?
Congratulations, Coach.
Yes, 14,000 views.
Napanood ko yung Go-Chu, 14,000. And I like yung mga tips nyo nun. Very practical, very value-adding. Ang gagaling.
Tsaka very empowering.
Yes, ang gagaling ng mga tips, tsaka ng mga advice.
I would like to also have a shout out or to my fellow mentors online last Wednesday. That's Miss Lodge, Miss Thea, and Coco. There. Tsaka sige, syempre na rin yung aming host, si Sir PJ. Yan.
Ang galing nung show.
Nag-enjoy ako ng very, very much doon. And another would be the recently concluded, this is yesterday lang, the financial wellness seminar that we did, and that's with Catherine Dalimot, Janine, and Amy, and that is from my team, Resolute Life, from Manulife. Another would be the kidpreneurship. Yan. Special mention to Sir Ed Tadeo.
Okay.
He was featured with Miss Riza Gonzalez. And si Sir Tadeo po ay meron siyang stint with Marvel. He is an illustrator and an inker. And sobrang interesting, well-engaged, well-attended yung seminars namin yesterday. And I would like to thank all the parents for attending yung mga nag-sign up for Kidpreneurship Batch 2. It's very engaging and nakakatuwa kasi inspiring yung mga kinuwento ni Sir Ed. How the kids can start and discover their passion and have that passion be developed into something that will earn profit in the future. So the Kidpreneurship project is spearheaded by yours truly. Yes, and we would like to help the kids that are currently attending that to be entrepreneurial. So very busy sila during quarantine period because that is already batch 2. Yes.
Congratulations dun sa inyo, so sa kidpreneur nyo.
Yes.
You are also adding value dun sa mga bata, no?
And that's part of our advocacy, continuous learning.
Napanood ko nga yung video no, sabi ko, this is the testament na tayong mga Filipino, mga very creative, very talented, di ba? Imagine Marvel, di ba? For you to become an illustrator or to do that, talagang you're really very, very good, Coach.
Yes. Oo. And humble beginnings talaga si Sir.
That's
Shout
right,
out,
that's
Sir Tadeo.
Shout
Hello.
out, Sir.
Thank you
Galing.
for gracing our event. And now, syempre, before we start everything, di ba, we would like to say hi to all the viewers that are watching right now. And before we introduce our guest, I would like to just tell you the mechanics of the game. So we will have a very fun night today at Coffee House. And if you want to win a prize, here are the mechanics. So listen very carefully. And this will also be pinned in the comment section in our page, Coach Aiet. Okay, just follow these 3 steps. Like and follow our Facebook page.
Like and follow.
Yes, and that's
Facebook page.
Coach Aiet.
Coach Aiet.
XDT and Company.
XDT and Company.
And Prof. Psy.
And Prof. Psy. Okay.
And then number 2. May number 2 pa.
Okay.
Like and share this live video.
Like
and share
this video. Okay.
Yes. And then tag 5 friends together with the hashtag Connecting Beautiful Minds.
Wow, I like that. Connecting Beautiful Minds.
Yes, ayan. And we will pin that so that you can copy and paste that in the comment section.
Okay. Coach, okay lang, shoutout ko lang din yung event ko this week.
Go ahead,
ladies and gentlemen, I'm so thankful to the Lord for the opportunity to be able to do this seminar. Number 1, shout out to Ms. Faye Quadra of Insular Life together with Union Bank. They did a mid-year sales rally, and I was one of the speakers there.
Wow! Is that the first time? First time ba yun?
Hindi ba? Yung mamaya yun. Yung first time. Ito, it's a mid-year sales rally ng Insular Life together with Union Bank. Coach, it was attended by more than 400 financial advisors, BMs, RMs, branch managers,
okay.
Branch managers, RM, regional managers, tapos mga executives nila.
Amazing.
It was really a fun day kasi we shared I featured yung tax and estate planning in its most practical sense. That's the first. That was last Wednesday. Then last Friday, okay. Another one. Ito yung first. Yung bank assurance ng Coco Life and UCPB.
Nag-merge ba sila? Nag-merge ba?
It's actually
collaboration.
Collaboration, yes.
Okay,
that's the word collaboration. It was attended by more than 500 hindi FAs, Coach, client. It's like a client.
It's like an investors forum.
Wow!
Investor forum.
And it's the first na ginawa nila.
Congratulations. And you were there.
Yeah.
Good job.
One of the speakers there. Congratulations to Sir Janus and Audrey. And of course, the officers and team of Coco Life and UCPB. It was a very successful.
Thank you, Coco Life. Good job.
Galing. Tapos,
congratulations.
Galing po nung event na yon. Then, of course, yung number 3, para naman sa mga brokers, ito, which was organized by Merit Real Estate, spearheaded by Stelio Campo, Tita Marie, and of course the ladies Carmi, Jackie, and Tintin. Ito naman, it was attended by more than 100 salespersons.
Okay.
So,
we're so busy talaga. Very busy talaga ang ating week last week. And it's very, very nice, what do you call this? To share. Yeah. Because that means that we are very... Yes,
Coach,
go ahead.
Yun. Sige, Bagdating ko lang, Coach, yun. Gusto ko lang mag-thank you, of course, first kay Lord for all of those opportunities. But more than that, I'm happy to note you're able to help fellow advisors and professionals.
Yeah.
Coach, on the lighter note, what's our topic for tonight?
For tonight, we are connecting beautiful minds. And dahil beautiful, and you are mind. Okay. Diba lahat ng mga audience natin are probably interested to know ano ba i-discuss natin today. So we actually invited a distinguished guest. Okay? Ang daming papel. Because napaka-distinguished ng ating guest and of course we would like to share with you very insightful practical tips here in Coffee House Chat. So we invite the best person for tonight's topic. Okay, simulan ko na. Medyo mahaba ang kanyang introduction.
Sige, Coach. Simulan mo na. Okay.
Okay. So our guest is a graduate of BS in Science, in major in Biology at the Ateneo de Manila University, earned her medical degree in UERM, and had a training in forensic psychiatry in Dartmouth Hitchcock Medical Center in New Hampshire. O, di ba?
Hirap nun.
Oo, forensic.
Hindi ko ma-pronounce yan, Coach.
Kaya dahan-dahan ako eh, di ba?
Dahan-dahan, oo.
Baka kung ano masabi ko.
Tama.
Ayan. She is a fellow of the Philippine Psychiatric Association, Chief Section of Psychiatry at the Makati Medical Center. And she is no other than Dr. Lovie Go-Chu. Good evening,
Good evening,
Doctora.
Hi, good evening, Coach. Good evening, Professor.
Hi, Doc. Good
Thank
evening.
you for having me in your show.
Yes,
for your
it is
time
a
as well.
pleasure. Yes, Doctora. We know that you're very busy. You're part of the front lines, and very timely and relevant ang ating topic for tonight. And thank you for gracing this event. I hope that our viewers will also get insights and takeaways as we converse in our topic tonight. So, Doctora, just to break the ice, how long have you been practicing in Makati Med?
Nako, mapaghahalata ako. I would say starting 2006.
Okay.
2006, so it's been more than 10 years.
Okay, and this is under the Department of Psychiatry.
Psychiatry,
Okay,
that's
okay.
correct.
Kasi natatakot ang mga tao pag sinabi, ay, psychology, ay, psychiatry, parang mabigat yan, di ba? Actually, guys, medyo may common ground naman kami ni Doktora. Hindi siya nakakatakot, di ba? Actually, to be in that kind of specialization, you really have to be talented, like Doktora, because, there are a lot of books, textbooks ang mga pinag-aaralan, and another is you have to be composed. Ikaw, may mga kailangang sort of meditation or something like that. Kasi when I was studying, medyo nahihirapan akong mag-intindi ng mga words because it's in Latin, usually, mga medical terms. Also, pag nagbabasa kasi ako, parang I bring myself into what I am reading. So, ganun ako nag-internalize, kumbaga.
Ganun ka ka-passionate, Coach?
Ganon. Oo, kasi ang hirap,
Nag-aaral ka,
ang hirap kasi ng allied med. Ito pa si doktora, med talaga, diba? So, back in college, that's how I feel about this subject. This is one of our subjects in physical therapy. Doktora, can you share a few insights on how are we in the Philippines in general, or basically in under your wing? Maraming cases ang mga ngayon, anxiety, ganyan, for example.
Yeah, definitely. Coach, Prof, I wouldn't even say that, the anxiety is pathological, because I think it would be abnormal if we didn't feel some kind of anxiety at this time. This is actually a shared anxiety. Everybody's feeling the same thing, even probably more so the health workers, and even as psychiatrists, psychologists, my colleagues, everybody's going through the same thing. So yes, it is very prevalent at this time because of the situation that we're in.
Oo, di ba? Parang it spares no one, no? And it's pandemic. That means it's happening not just sa patients, but also to us who are actually not in the hospital, not even practicing medicine. We can also feel it. What more if there are people who are, yung mahina talaga yung loob, 'di ba? Yung by default parang kasi 'di ba may tinatawag na adversity quotient. I would like to relate to that na parang yung batch ko, Gen X, medyo nahirapan yung paano maging resourceful, yan, hindi ibibigay sa'yo lahat. So parang kung ang personality mo you are pinalaking affluent, yan. Parang hindi ka sanay masyado sa mga adversities.
Hindi masyadong sanay na nahihirapan, Coach.
Oo. Actually, marami akong mga nakakausap, hindi ko na lang sila babanggitin, pero may mga lumalapit na parang yun nga, ewan ko ba kung bakit ko sila na-attract. Bakit ano, parang feeling nila, wala akong problem. Or di ba usually ganon, if you are bubbly, di ba, you lit the room, na when you enter and when you're feeling that your conversation is, parang nakakagaangan ka ng loob. Parang, it's so nice to confide in me. Diretso.
So you're that person. Cool.
Oo. Pero ako naman, it's a very good problem for me because people go to me that way. And siguro nga dahil tinawag nila akong Coach Aiet, dahil may pag-ibig, may mga ganyan sa financials. So parang nakakatuwa lang din na somebody will listen to you. So how is how are you coping? What's in a day in your work at home? Can you tell us something about it?
Well, at this time, kasi I don't go to the hospital as in like do face-to-face clinics. So of course, like if you have like referrals in the hospital, I would have to go to the hospital. But for as much as possible, I manage my patients as outpatients just because if you don't want to go to the hospital, you don't want to expose yourself, your patients also, and yourself to the hospital. So a lot of my work now I do through telepsychiatry.
Nice.
So most of it is done like online already.
Oo. Online daw, Prof. Sai. Even the telemed na ngayon talaga, ha? Kala ko dun sa ibang bansa lang yan.
Because of technology. Pero Doc, yung system na ginagamit nyo, so kasi, diba, there seems to be a surge of demand for Zoom, no? So I have heard Zoom as early as mga a couple of years ago, but of course, ang Filipino kasi hindi masyado sa ganun eh. So usually, what technology do you use for nagpa-consult ako sa'yo? O ano po ba? FaceTime, Facebook, or paano po ba?
Personally, I use Zoom and sometimes Viber, but there are several other platforms that are available that other doctors might be more comfortable with. So usually it depends on the preference of the particular practitioner.
Okay. So sabi ko nga, ang sa mga prayers ko sabi ko, Lord, thank you for the gift of life and thank you for the gift of technology, Because of technology, kahit now we have this challenge right now, Coach, yung COVID, kahit paano it helps a lot of Filipinos na we are still in touch with our loved ones, our kapamilya, kapuso, whatever you call it, kapatid, di ba? Like this, we're able to do this because of technology. Yes, Coach.
Yes, very true. Siguro gusto lang nilang marinig yung golden voice ni Doktora. Yan, para medyo daw yung voice. Anyway, yes, you mentioned something about the interaction online. Not only that, na naka-reach out tayo to as far as the tip of the Philippines or the top of the Philippines, but it also, as what Doktora mentioned, hindi na kailangan pumunta ng hospital. So, nasa-save mo din yung family mo, yung life mo, tsaka yung patient because you are not putting them at risk. Tsaka yung swab, di ba, Doktora? How much is that? Ang sakit daw nun.
8,000 ang average.
Oo, diba? Oo.
And bali na yung cost It's the waiting. Because I've had myself swab na, it's really the waiting. Makati Med turnaround time is like 24 to 48 hours. But ang nakakatakot dun is the waiting while you're waiting for the result. Yun talaga one of the longest 48 hours that you've had in your life.
Agony, no?
Agony talaga.
Diyos ko.
Ano ka na, mag-iisip ka, Kung ano ba resulta
ng check kung lumabas na yung result.
Correct.
Yeah.
It causes anxiety rin,
dahil dyan, magpapatrivia tayo, di ba? You mentioned something about swabbing and ito, very prevalent itong word na to. Very famous. Quarantine. That's a trivia for today. For tonight. Yan. Can we flash it on the screen? We will also put it in the comment section so that yung mga viewers natin na nakikinig right now will be able to Google it or look it up in Google. Where did the word quarantine come from? Ayan. Tapos, later, may surprise kami kung sino man yung makakasagot niyan. Okay, going back to Doktora, yan sabi natin, di ba, pandemic, swab, quarantine. What are the causes of anxiety? Usually, yun naman ang top nating Can you say something about, ano ba to, nagyayari na lang bigla or may pinanghuhugutan? Can you expound on that?
Okay, let me start by saying that anxiety, like stress, is part and parcel of our everyday lives. It's impossible to live without stress. Even the most sheltered person, let's say, super yaman, everything has been handed to that person on a platter, etc. Tapos meron gustong, let's say, isang bag na parang sobrang coveted na bag. Pag hindi makuha yon, that's stress already. So truly, the goal is not to eliminate the stress, but to be able to live with that stress. Now, during this pandemic kasi, this stress is universal to all of us. We're all going through the same thing. And, it's very hard to say kung kapag ganun ba, kapag nagkaka-anxiety, ibig man sabihin yan, lahat tayo may sakit. No, it's not like that. It is only when the anxiety becomes like so bad, the intensity is so severe such that, or it becomes like so persistent, hindi na siya nawawala, or it's so frequent, or that it interferes with your daily functioning, that is the time that anxiety already becomes an illness that has to be treated.
Oo,
okay?
Tama.
Oo. So ngayon, what are the causes? Iba-iba kasi. First is like when you have anxiety kasi, you would want to rule out muna yung mga medical causes of anxiety. Because like there are certain illnesses, like for example, pag hyperthyroid yung isang tao, parang pwedeng magkaroon ng palpitations, tapos parang mabilis yung heart rate.
Yan ba yung panic attack?
It will manifest similar to panic attack. So kapag ganun, that might be interpreted as anxiety when in fact you have like an underlying medical cause. Okay, so you're able to like rule that out already, then will come in like in different kinds of anxiety. So for example, you can have like mga panic, like sinasabi mo.
Yeah.
You can have like generalized anxiety. Some would have like mga phobias, specific like takot sa spiders. That's under anxiety also. And you can have like mas social phobias, yung takot magsalita in front of groups. So those are the different kinds of anxieties that one may have.
Pero usually, I'm not sure if you have encountered, but yung mga nasa business, nasa negosyo, ano yung usual anxieties nila? I'm sure alam na natin yan pag ay sarado, ay ang taas ng tax ko, mga ganyan usually, diba?
Alam ninyo, business person, hindi ka pa man business person, lahat meron yan eh.
Meron.
Particularly the patients or even the people that I know who are like businessmen, lahat may problema. Wala ni isang wala. Ang ano lang yan, from the one na parang who's doing like home businesses, yung mga dumidiskarte over the quarantine, yung mga nagbe-baking, yung mga may problema yan. Problema like relating to yung mga, let's say, yung mga kasamahan nila sa negosyo, kung yung mga small businesses, kasama mo yung boyfriend mo, friend mo, nakaproblema dyan. Up to the highest, yung one of those biggest businesses that are booming right now. Ang problema naman is, syempre, you have to deal with the people. And these people are dealing with like COVID and fear of COVID. The cost of doing business has gone up. Ang iba naman dyan, yung mga nasa medium enterprises naman, ang problema mo, nagsara yung mga negosyo, yung mga tao mo, paano mo papasweldohan. So everybody who's in business, kahit pa na it's flourishing, kahit pa na it's doing well, if it's not doing well, lahat yan may mga problema talaga.
I see. This was the discussion, Prof. Sai, last Wednesday because we were asked by Go Negosyo as to how do we thrive now it's COVID. And my co-sisters from New Philippines, this is an all-girl or all-women entrepreneurs, said na nakaano talaga, nadaanan namin yung mga situations wherein ito yung negosyo mo, tapos biglang sobrang nag-deviate ka from your core business to thrive. So, another would be, syempre naging mas madasalin ang mga tao ngayon, which is actually good. Kasi COVID naman, hindi naman all negative yan eh. Di ba? We get to bond with our family, di ba? Prof. Sai?
Yeah, Coach, I like yung sinabi ng isang speaker. Sabi niya, do not let a good crisis go in two ways.
Tama.
Yan. Bakit? Kumbaga, these are extraordinary times, but looking at the bigger picture, maraming mga positive, I don't want to use the word positive, maraming mga optimistic results na nangyari, di ba? Sabi ko nga, in terms of family, bigla nating na-realize na mas marami na tayong time sa family natin, di ba?
Exactly.
Kumbaga, may nakita nga ako Doc, na isang picture sa Facebook na yung isang portion ng bookstore. Ang unang naubos, Bible. Diba?
Wow, galing.
Bible.
Yeah,
natutuwa rin.
That's a good thing, no?
It's really a good thing. Kumbaga, itong situation natin right now, it is extraordinary, but at the same time, marami siyang mga benefits or gifts
opportunities, no?
Opportunities, like sabi ko nga, ito is sa mga tawanan ngayon wala na raw traffic ngayon sa EDSA. Nasa internet na raw ang traffic ngayon.
Which is
Wi-Fi.
Which
Trivia,
is
Doc,
true,
trivia. There are around 76 million Filipinos na using internet every day.
Really? Wow.
All at the same time.
All at the same time, di ba? All at the same time. Kaya kumbaga, it's sabi ko, it's both a feast and famine. Feast kasi nagkaroon ng mga opportunity, especially dun sa telco industry. Famine because those who do not want to adjust and adapt, talagang either they would close or they would simply slow down yung business nila. And Doktora, itong show namin, the very reason it happened because we wanted to help entrepreneurs, professionals by doing this. Ano to yung advocacy to ni Coach Aiet.
Para sort of ma-entertain na lang kahit paano kasi we wanted everybody to be engaging, sharing their insights. So primarily, we want our clients and those friends that we have na if you are able to voice it out, maybe it lessens the burden, diba, inside.
True. That's right. O tingnan mo, and you were able to discover your talent as a DJ.
Oo nga.
Diba? Which wouldn't have happened maybe if we're not for this pandemic.
Tama.
Matagal niyang gustong gawin.
College pa ako actually.
Sometime April, sabi ko sa kanya, when we were having the ECQ, di ba, Doc? Sabi ko, I think this is the best time para maging DJ ka.
Oo nga. Tignan mo, na-discover mo yung talent mo.
Speaking of anxiety, bigla siya kinaman, sabi ko, kaya ko ba? Sabi ko, don't
shy type ako
just do it and I will support you. Gawin mo lang. Gawin mo lang. So we have this coffee house chat. Ito na po yun.
And actually, maraming kaming mga friends and even the ministry that we have in the church, yung social media ministry ng Our Lady of Fatima, which are mostly kids, no? That we actually build. Sabi namin, mag-form tayo ng organization so that, bukod sa busy, you get to express yourself, and then maybe we can also help the parish. So sabi nga namin if we are in any way able to inspire and empower people through this session, we'll just go with it, and we will continue. And going back to the coffee house chat topic for tonight, we would like to also let our audience know that psychiatry is not scary, guys, ha? Kasi usually, lalo na nung ako din before, pag may record ka sa psychiatry, alam mo na, di ba? Parang hindi yun ganon, guys.
That's a misconception.
Yes. It's sobrang misnomer siya.
Coach, talking of misconception, tanungin natin si Doktora. Ano ba yung mga common misconception about psychiatry nating mga Filipinos? Especially tayo mga Pilipino kasi tayo mapagbiro, very playful tayo, di ba, Doc? Sige nga, Doc, can you share some of the misconception na pwede natin i-correct?
I think the most common and most prevalent one will be na if you're seeing a psychiatrist, sasabihin parang may sira.
Parang may ganun.
Ako, taga-Mandaluyong pa naman kami.
Taga-Mandaluyong pa naman kami, Doc.
And that's really bad for people who have the courage to seek help when they need to. We get a lot of patients, and majority sa clinic, the patients that we get are parang mostly anxiety, nagpa-panic attack. Some of them would have like depression, and some of them, they just need therapy. They need to sort things out in their head. They're going through a very difficult period in their lives, and they just need somebody to be a witness to what they're going through and to help them like figure out what their options are. You see, so these are all very normal people, quote-unquote normal people that we're getting. So hindi siya yung just because you're seeing a psychiatrist, there must be something wrong with you. Some we get like, politicians, artista, business people, everybody. And then just because, they get referred to us kasi hindi makatulog. You see? So these are normal daily concerns that would sometimes plague us at one time or another in our lives. Right. And you know what? Ang nakatulong yan, I just saw a patient makakatulong. She was so she was so courageous.
Mm.
Ang ginawa niya was that, I have this depression and I want to share it with my friends. So she posted in her Instagram. Tama ba yung mga stories?
Yeah.
So, hindi ko masyadong alam yung mga ganun. So anyway, so she posted sa Instagram niya. And then, a lot of people, she was overwhelmed by the replies that she got because people were saying, oh, ikaw rin pala, you have depression.
Nakaka-relate.
Nakaka-relate. Just because people have the tendency to just keep everything sa sarili nila and they figure that they're going through all of these things. Sila lang ang nakakaramdam. And when they do eventually find out that other people are going through the same thing, then it's such a big relief for them.
Yes. Kasi if you're not getting it at the primary circle, which is the family, usually, di ba? You have to, some people would like to just keep it. Tapos hanggang nagiging na sila, what do you call this? Lumalala. Because yung dapat at the onset pa lang, yung sa start pa lang, kung naisabi mo siya because sabi mo nga dapat courageous ka. Kasi if you want to share, just speak your mind, di ba? Yun eh. That's why we say it's connecting beautiful minds because as for your example, you mentioned one patient, nung lumabas siya, mas marami pa pala siyang natulungan and she got the love that she needs, di ba? In order to be well. So I think na makakatulong yun.
Coach, regarding since we're talking about anxiety, Doc, may ba siya? May direct correlation ba siya dun sa mga incident ngayon ng I hope.
Yung parang pandemic-induced ba siya?
Yung suicide, if I may, sorry for the word, parang may siyang direct correlation with that one. Kasi parang, lately, if you're looking at social media, parang there seems to be a surge ng mga ganong incidents. I'm not saying na
it's caused by, hindi naman. Pero parang baka lang natataon.
Meron ba siyang correlation regarding sa anxiety?
That question is very hard to answer just because we don't have the statistics for that. Kasi sometimes, probably baka yung mga nare-report would be the ones that have been sensationalized, diagnosed with COVID and then tried to commit suicide or committed suicide. You see, but those are the ones that we hear about. In practice, there's also the flip side of it. Kasi since everybody's at home, kunwari kapag merong mga suicidal thoughts, let's say, and we're able to pick it up. Whereas before, papunta na sa hospital para ma-admit na, so the patient would be safe. You now have like a whole network of support for the patient. So instead of papuntahin mo sa hospital, then sasabihin mo, ay bantayan niyo sa bahay. Since everybody's at home, please make sure that this person is not left to himself or to herself. Plus, that person will now be able to talk with yung family, will talk with the family. So tapos yung support talaga, medyo mas nadadagdagan din. So I really don't know kung dumadami yung cases or hindi because I don't have the statistics to
very
back
fair,
it up.
Because una-una pwedeng yung mga nababalita, it's not really based on, baka one-off lang siya or
nasa sensationalized na lang, no? Doc, no? Tama.
Yes. We have a comment here and it says, anong dapat gawin pag nagpa-panic attack?
Yun, I like that. Sige.
Yeah.
Parang pag mag-isa ka lang, paano yun? Paano pag mag-isa ka lang?
Yeah, ganun kasi, no? Panic attacks, pag medyo marami na, tapos parang it's become like more frequent and then it becomes panic disorder. Pero kunwari kapag mga panic attacks lang, and kasi there are different treatment modalities. Siyempre, if it's like a disorder and it's really very, and it affects already the functioning, we have to give medications eventually. Pero kunwari, kapag mga isolated attacks, maybe what they can try to do is mga grounding exercises. So,
may exercises din pala.
So the most common one would be like mga deep breathing exercises. So when you do deep breathing exercises, it's really just like, breathe very slowly, take deep breath in, like maybe over a count of 4, and then hold it for a bit, so maybe another count of 4, and then release it over a count of 4. So dapat mabagal siya. Hindi siya yung hindi ka pwede para magka-hyperventilate ka niyan, and that will contribute more pa to the anxiety.
Lalo ka palang nervous yun pagka ganun.
Oo.
Parang hinahabol mo yung breath mo, diba?
Oo. So you have to do it properly, and then you can do it like maybe 10 breaths like that, very slow, deliberate breaths. Other exercises that can be done would be parang using the 5 senses. So you can take a deep breath in, and then just to ground yourself. Kasi the point is, kapag nag-anxiety ka, ang dami na tumatakbo na yung utak mo, dami mo na naiisip eh. So what you would want is to ground in the here and now. So what you can do is, like, for example, take a deep breath and then start saying out loud 5 things that you see. So for example, I see a pillow, I see a chair, I see a bed. So 5 things. So you ground on what you're seeing currently.
Ano yung doktora, kunyari, nasisiya, ghost pa.
Nay, wag naman.
Diba?
Ikaw na.
Hindi. So dapat anything that is really there. Okay?
That's there, oo.
Okay.
Tapos you can, like 4 things that you can feel. For example, you can feel the chair against your thighs, or you can feel the floor against your feet. So 4 things, and then you say it out loud. And then 3 things that you can, 3 things that you can hear. 3 things that you can hear. So I hear the neighbors talking, whatever. So I can hear whatever. And then 2 things that you can taste, or you can 2 things that you can smell, and then 1 thing that you can taste. If there's nothing that you can taste or smell, then you can say out loud something that you would want to taste or something that you would want to smell. And then after that exercise, take a deep breath out. So the point really of that is to ground you in the here and now, so that your mind is not like flying constantly and worrying and catastrophizing about things. So those are common exercises that can be done when somebody's having like a panic attack. And of course, others, if you're trained in yoga, you can do that. Kung maganda na talaga, kasi it's very hard to call on a skill kapag hindi ka naman trained in that. And of course, you also have like yung mga mindfulness techniques. Those mga mindfulness techniques talaga, may mga studies na yan eh. Pero again, you have to be practicing it already, so that when the panic attack comes, parang you can call on it anytime. Mahirap siyang kung kailan mo kailangan.
Tama ang aralin. Tama. Dapat nagpa-practice talaga. So tama talaga si Miss Alu din last week, no, Professor Sai?
Correct.
Very, very practical yung mga tips.
Maganda yung sinabi ni Doktora kanina, yung sinabi yung sa breathing. Alala namin, Doc, kasi last week, when we were, ang guest namin si Miss Alu Santos, sabi niya, ang pinaka-importante with what you're doing is the breathing. Yan.
Dahil sinabi about breathing, you have to be conscious and you have to know.
It has to be deliberate.
Yes.
And yung sinasabi ni Alorena, ang isipin mo lang yung breathing mo lang.
Nothing else.
Just focus on it.
Nag-take notes ka ba, Professor Sai?
Oo.
Ang dami sinabi ni Doktora.
Oo.
Meron siyang 5 senses, tama ba? And then yung breathing exercise. So for those people who are asking for the cure, etc., well, that has to be a one-on-one session. Tama ba, Doktora? Kasi it has to be diagnosed para ganyan. And if there will be prescriptions, then it should be a one-on-one consultation. What we are sharing here is that what are the parang first aid that is easy to remember. Parang if you are in an emergency and you are alone, these are the things that you can do. So and if you want to go back, you can replay later. But we would like to give you more discussions on how to deal with it. Yes, Doctora, sorry.
Sometimes makakatulong. Sometimes I tell my patients, kasi we don't like to keep on relying also on medications. Sometimes you can tell them, make a playlist already, like a playlist of very relaxing music, such that, if you're starting to feel anxious already, you just like put it on and that should calm you down. And sometimes, some people, if, they like scents, yung mga
essential
oils that are very calming, pwede na pahid or magpausok o yung
gano'n.
That they, you can use that also. Yung mga gano'n, parang may usok-usok na aromatherapy.
Aromatherapy.
Yeah, anything that will help, anything that will help.
But it has to be conscious effort. Tama ba? It has to be. Parang, kumbaga guys, meron na kayong filing cabinet sa isip ninyo na, okay, I'll pull this track because I'm starting to feel it. Or sometimes, like, what I see also, usually a pet or something. Tapos, pag
Oo,
mainit, di ba?
pwede din.
Di ba? It's also touch. So,
Tama.
yeah.
Oo, nakakatulong din yung ganon. In fact, I have a patient na parang hirap na hirap ako to control the anxiety. And then finally got a pet and considerably
really?
improved yung got a cat.
Okay.
And then the anxiety considerably improved.
Oo nga eh.
Kasi-
Nakita akong ganyan sa video eh. Parang,
Oo.
alam na dun, yun sa kanya naman dog, alam na ng dog
Oo.
na padating na yung attack. So tatabi
Oo.
na sa kanya.
Oo.
Tatabi na sa kanya tapos, ang ginagawa, ano lang niya, yung fur ng dog. Tapos magpipik yung panic and then later, kakalma na siya.
Oo.
Okay,
So I guess the take home is that you really have to find out what works best for you. It's not like a one size fits all kind of thing. You have to find out which one is will work best for you.
So for example, hindi ka naman makatulog, so maybe you can have a Bible reading or something that can, well,
Pwede.
for me or kay Professor Sai, pwedeng yung textbook niya, yung sa akin, half book, wala, 1 page pa lang, tulog na ako.
Tulog ka na.
Pa rin talaga.
Oo, di ba? Buksan mo lang yung regulation, di ba?
Yan ang biruan namin, Doc. Sabi ko, hindi ka ba makatulog? Ito yung textbook ko, magbasa. After 1 or 2 pages, sabi niya, untok na ako.
True. And that's what I tell my patients also, if you have to watch something, if you have to read something, nothing too exciting.
Correct.
Read something boring. And truly, para medyo makatulog. And that's part of sleep hygiene talaga.
May bago tayo, sleep hygiene.
O, diba?
Sleep hygiene.
Ayan, mga takeaway, isulat, guys.
Doc, si Coach Aiet, may ritual yan. Pag yan stress, sasabi niya, Dad, pamasahe naman. Medyo, ganyan. Hello, physical therapist yan, pero baliktad. Ako nagmamasahe.
Grabe ka.
Lugi ka, Professor. Lugi ka.
Guys, ang physical therapy, hindi massage ha. Topic lang yan sa amin.
Okay, sige.
Naging defensive naman ako doon.
Pero alam mo yung massage, yung rituals din. And that's another part of sleep hygiene. If you're able to develop rituals at the end of the day, telling you that it's time to wind down, it's time to finally, put things to rest na muna, put your mind to rest. That's part of developing rituals is actually part of sleep hygiene. So you're practicing sleep hygiene without even
knowing. Aside from that, I also meditate. Ayan.
Yeah.
Nakakatuwa pa nga dyan, Doc eh. Di habang nagmamassage ko siya, nagkikwento. Wala na pala ako kausap. Tulog na yung kausap.
Magaling ka magbasahe kung gano'n. Lalo siyang magpapamassage siya sa'yo niyan.
Oo nga, unfair nga, Doc. Siya yung PT, ako yung nagmamasahe.
Lugi.
Siyempre, tulog na. Ako naman, sino magmamasahe sa akin? Tutulog na lang ako. Diba? Napagod na eh.
Yeah.
Yan.
Lalo ngayon, Doc, ako.
Bawal kasi ang mga
Maulan.
Bawal. Hindi bawal tumawag kasi they cannot go into the units. Diba? For safety reasons.
Oo nga.
Okay. So ang daming questions. How will you engage a person with a suicidal thought? Diba, we mentioned a while ago na it depends on if it is something na genetics, may genetic play ba ang suicidal or hindi naman. So it's really parang acquired. Medyo ako dun eh. Iba-iba siya.
Iba't ibang patients, iba't ibang kaso. Sometimes you can have those na previously kala mo okay na okay, tapos something big happens and they feel that they will not be able to cope. And impulsively, they can try to commit suicide. And you can have suicides also that are part of major depressive disorder.
Yes.
Kapag yung parang feeling na so hopeless, feeling very sad.
Robin Williams, diba? Tama ba? Robin Williams.
Dok, yung mga sikat na foreigners, no? Yung mga sikat ka, mayabang ka, you get to travel. Yung kilalang chef, no? Si
Anthony Bourdain.
Yes. I like watching him kasi Miling ako nung nanonood ang nagluluto. Galing. Sabi, one day, mabalitaan natin na wala na siya.
Diba? Yun na diba? Kaya truly, yung mga ganun kasi, that part probably was part of parang clinical depression. So, hindi natin pwedeng sabihin, depression lang yan, mahina lang yan, tatagan mo ang loob mo, magdasal ka lang, okay ka na. It's not like that because depression really is an illness. And, at the worst end of it is that the person may decide to commit suicide.
Parang parang naalala ko yan 2 years ago ba or last year lang. Parang ang daming tumalon, di ba? Parang yun yung mga nasa balita. Of course, we don't want that to be discussed in full detail because we also wanted to bring hope and positivity, yung optimism. Yun yung gusto natin.
Optimism, that's right.
Yes.
I'm sorry, so going back to your question,
ahead,
no, you were asking like how to deal with well, first and foremost, wag ninyong iisipin na just because you asked about it or you talked about it would like make it concrete for the person who's thinking of like doing it. Most of the time pa nga, it will be a relief for the person to be able to talk about these thoughts.
Outlet.
So as lay people, it is not your role to treat or parang gamutin or pagalingin yung taong who's like having suicidal thoughts. Truly, kapag may suicidal thoughts, that is a psychiatric emergency. And that person has to be seen by a professional.
Tama. I agree.
Most as a friend that you can do is to like listen and then encourage your friend to get help.
Okay.
Yes, I agree.
Kung kailangan talaga, then talk with the family member.
So that they can bring that person to the hospital.
That's correct.
Yes, guys. So huwag matatakot kapag may mga friends na ganon. It means your friend trusts you, di ba? Para to confide in you is such a very siguro difficult decision also na bigla na lang pumasok sa isip niya. And another would be the family para dapat yun ang talagang unang takbuhan. Pero kapag wala noon, maganda na rin yung mga, yung next circle mo, which are the friends. But for those listening here, tama naman yung binanggit ni Doktora, let's not play doctors because we're not. And pas matutulungan natin sila if we are able to send them to the right person who can actually arrest the whatever it is that they are feeling or yung mga nafe-feel nila na hindi dapat.
Sometimes kasi the friends are caught in a difficult position. Sasabihin, sige, sasabihin ko sa'yo, pero huwag mo sasabihin kay ka.
Exactly.
Yung mga ganong instance na pag nag-confide, tapos maririnig na lang niya na pinag-uusapan na siya. So lalo nang naging stressful yung buhay ng tao.
Hindi naman yung parang i-reveal mo kung kanina. Siyempre, hindi naman pwede yon. Pero to the right people, you have to talk about it to the right people. In this case, usually the next of kin. Because that's an emergency situation.
Correct. So, in relation to that, there were actually 2 more questions, but dun na lang ako sa discussion natin, parang, is there any way, for example, you're the friend, is there any way that you can recommend motivations on how to push oneself to be productive? Kasi di ba parang, we empathize. We listen to the person. Parang, as a friend, meron ba tayong masasabi na, you know what, siguro hindi natin pwedeng sabihin na, you know what, I understand what you feel. Kasi kung yung friend hindi naman ganun din yung feeling, di ba?
Parang hindi naman totoo yung dating yan kapag
Kasi everybody's pagod, exhausted. I could just imagine the front lines, di ba? The ones really in the hospital.
Frontliners talagang...
And not only the ones in the hospital, the front lines that are coming to the office.
Grocery, yung mga nasa banks.
Oo, di ba? Parang because kailangan bayaran ang mga due dates. Si Judith, nandiyan naman palagi.
Si Judith, nga.
Diba? Hindi siya nawawala.
Na coach, nausog lang ng konti.
Parang sa tax, di ba? Ano lang yan? Pangalan ko.
Extend lang ng konti ng government.
Pero magbabayad ka pa rin.
Pero magbabayad pa rin. Totoo.
So, what are the recommendations on how to motivate or push some or yung oneself or yung friend mo, kailangan yung exercise, breathing, diba? That's what we said. And then the use of the 5 senses na remember that you have to ground yourself, ground exercises.
Those are for mga anxiety, yung mga anxiety symptoms. So, if somebody kasi, we're now talking about depression ba? We're now talking about depression. Kasi ang depression kasi, if this were clinical depression, if this were clinical depression talaga, part of the symptoms would be like loss of interest. So, talagang medyo mahirap to push somebody, sige na, exercise ka na, sige, go try all of these. Kasi part and parcel of the illness is that loss of motivation, loss of interest. So, kapag ganung klaseng depression kasi, that kind of depression has to be medicated. Pero kunwari, if this were just depression, parang adjustment. Let's say, depression kasi nakipag-break sa boyfriend, or depression kasi bumagsak sa exam. These are situational. These are situational na depression.
Yes.
So those are the things that, as a friend, pwede mong, uy, sige, ano muna tayo, o usap muna tayo, or if they were not under quarantine, sige, labas muna tayo. Yung mga ganun, makakatulong yung mga kaibigan, like that. Pero kapag yung clinical depression na parang walang motivation, yung mga ganun kasi kailangan siyang magkamot.
Okay, so that defines it. For example, pumunta lang yung friend mo, humagulgol because of a one-off situation. That's what Doctora is saying. It's not anxiety. It is attributed to a certain scenario na because syempre everybody is entitled naman to be sad kapag hindi naman nangyari yung gusto mo.
That's depression.
Yes,
The difference sometimes kasi we have to, usually they come hand in hand, the depression and anxiety.
Yes.
Depression is mostly parang sad mood, and sometimes a deeper kind of sadness. Tapos may loss of interest, hopeless, helpless. That is depression. Ang anxiety is more of parang nervyos. Sometimes it's a free-floating kind of anxiety. Sometimes, it's a panic kind of anxiety. Bigla na lang, in a minute, kakalubog ang puso, nasusukat.
For no reason.
Yan yung mga panic na anxiety naman. These are two separate things, but usually they come hand in hand, ang depression and anxiety.
Yes.
Especially ngayon, coach, especially ngayon na tayong mga negosyante, yung mga nakakausap ko nga po mga kaibigan ko, mga business person, ma'am, yun ang sinasabi nila ngayon, sabi niya, stressful lang practice natin ngayon, prop side, because of yung mga ganitong situation, may mga kliyente ka pero hindi naman nakakapagbayad, may mga bills kang kailangan mong bayaran. Kanina lang, di ba, coach, nung pinunta natin yung isang building, sarado lahat ng
lahat for lease
For lease na, doktora kasi sarado na yung mga business. And those would really contribute to a lot of anxiety and eventually depression, no? Tama ba? Anxiety, depression, ganun po ba yun?
Hindi naman. Sometimes somebody may have anxiety lang without going into depression. Some people can have depression without having concomitant na anxiety. Pero usually karamihan na nakuha namin ngayon anxiety. But you're correct.
Yes.
You're correct na sometimes kapag prolonged yung anxiety, it may eventually
lead to depression.
Clinical depression.
Okay. So guys, chill lang, no? Chill lang tayo. Kapag kinakabahan na, bawas-bawas muna sa kape. Tama ba?
Ayan na.
Kasi ganito yan. Kasi parang medyo nagiging serious na tayo, di ba? Ang sa akin lang, if you want to what you call this, just speak your mind to a friend, di ba? As an outlet to, if you cannot speak to your family, I encourage a close friend. Yung friend mo na hindi naman magsisqueal ng mga secrets, di ba? And also, if, for example, it's really parang nagiging more frequent. Yung frequency, how frequent? Like every month? Hindi naman.
Well, may mga diagnostic criteria dyan.
Okay.
Pero kasi in general, what we know is that once it starts to affect your functioning, to the point na you have difficulty relating with the people around you, you have difficulty performing your work, or sometimes it's so bad to the point that you have to take substances, maybe alcohol, just so that you'll be able to function because of the anxiety. Yung mga ganon, dapat talaga, that one will have the sick
Okay.
And going back to the this COVID related na anxiety, you're right. I was seeing like a lot of business people affected.
Yes.
I was talking with like one of my co-psychiatrists, I say, how do you deal with this? The situation is really so uncertain, and there's no end in sight. You see, and everybody's feeling the same thing. Alam mo na namin is, truly you just have to to adapt. And I think the sooner that we accept, some people kasi are still expecting that things might go back to the way that it was.
What is normal, di ba?
Yun nga di ba?
Alam mo normal
exactly. Kasi if you're going to define normal as like how it was maybe before this COVID came along, then definitely I don't think that's happening.
Correct.
But the sooner we accept that, there might be like certain ways of like doing things now, different ways of doing things, then the sooner we accept that, the sooner I think we will adjust. I learned a lot from my patients. Ang galing ng patient, kasi sabi niya, I just have to continue living. It's just that I have to live differently.
Tama, di ba?
Ang ganda
Oo,
niya, ang ganda ng
quotable
ano,
quote.
sinabi niya.
Quotable quotes yun.
Galing,
I have
galing
to continue
talaga.
living, I just have to live it differently.
Differently. Oo, galing
Galing.
Parang yung previous week naman, live the change.
Live the
Diba?
change. Ngayon, live.
Continue to live.
Continue to
tayo.
live, but live differently.
Oo, galing nga nung
Galing.
I learned so much from my patients also.
Oo.
Galing.
Tsaka ano yun,
Sige, coach. Ikaw muna, coach.
what I would like to, to add to what Dr. mentioned is that dapat hindi kasi sila, yung nadi-discriminate. Diba usually kapag sinabi na, ay naku, may ano yan eh, or something like that. Lalo na lang the person will not say yung ano yung nasa loob niya. So, pag may mga ganyan kayong nakikita or na-experience guys, just listen to them. Tapos parang kung ikaw mismo, parang naka-apektuhan ka na, you can ask somebody naman, di ba? Pero yung person na nag-trust sa'yo, who actually experienced that, isipin mo na lang na hindi rin madala doon sa person mag-open up. Mahirap yung nararamdaman niya, but it's also difficult to open up.
To open up, no?
Yeah. Oo.
So, effort yan. And, but don't worry, especially those who are experiencing this, because that's the reason why we're having this chat, because we want everybody to know that hindi kayo nag-iisa. Diba?
Exactly.
Hindi kayo nag-iisa. And there are a lot of things that are simple that you can do at home, or maybe you can contact the professionals about how you feel about things, di ba? And of course, huwag makakalimot tumawag kay Lord, di ba?
Correct, that's the best. Totoo yun. Coach, may gusto lang itanong ito. Medyo light lang itong question na ito, Doktora. I hope you don't mind. Paano lahat? Kasi kayo namang mga psychiatrists and professionals, you also experience that. Pag kayo naman na naging experience na anxiety, yung kinakausap nyo rin ba yung kapwa nyo psychiatrist? May mga ganun ba na CPA ako. May problema rin ako sa taxation minsan, pero kakausapin ko kapwa rin CPA.
Yeah,
you also want a different point of view. Can you expound on that?
Yeah, that's what I always tell my residents also. You develop these friendships during residency. And these are people who know what you're going through, who live in the same world that you're living with. So for example, kapag meron akong very difficult na case, na parang feeling ko parang hindi gumagaling and parang I've exhausted like I think all means na, it would sometimes help to have like another a different perspective on things. So I would talk about the patient, of course, parang confidential, walang identifying data,
walang name.
Tapos to just get a perspective, maybe I'm missing out on something.
Yeah.
So,
outside of the box, diba?
Diba? And that ends up for better care for your patient.
Yes. You mentioned residency. Shout out lang natin very quick si Dr. Jing Isidro. Hi, Doktora. Ayan.
I-ano ko na rin yung mga residents ko. Hello, terrorize ko na residents.
Paibatin mo na, paibatin sila.
Yes.
Paibatin sila.
Ayan, si Orma, si Dayan, si Miguel. Sino pa ba? 2 Miguel. Si Jess, si Lay, si Offie, yan yung mga mga residents ko. They're doing so much work for the section kasi we're doing a lot of work for our frontliners. So we have a lot of programs in the hospital. So sila yung gumagawa ng mga hindi ko kaya, yung mga Facebook page, yung mga lahat ng
mga talented pala ang mga residents ni Doktora. Hi guys!
Thank you so much sa inyo guys.
Keep it up,
You're helping Doktora. Galing.
So you were saying before I mentioned Dr. Jing is a neurologist, tama ba?
Si Jing is endo.
Sorry, endo pala siya. Ayan. As you were saying something about collaborating with your
Tapos
team.
kahit na sometimes parang punong-puno na yung utak mo.
Yes, nakaka-exhaust din.
Just need to magchichismisan lang kayo, kwentuhan.
Yun, tama. National pastime ng Pilipinas.
Milk tea.
Usually.
Diba?
Kasi kapag ganun talaga, and then after that, parang feeling mo ang gaan-gaan. Parang wala naman kayong pinag-usapan talaga, just a lot of random things.
Right.
So it truly helps to have somebody that it does, and you don't have to be a doctor for that. You can have somebody like that in your life, kahit na sino, doktor ka man, accountant ka man, business person, housewife, lahat yan. It will help somebody like that.
So what matters is that you express yourself, especially if you're up to the brim already.
Kami nakikinig. Yung pala, no, Doc, napaka-importante na. So, let us say, kung ako may nararamdaman akong gano'n, diba? Pag hindi mo kasi siya sinasabi, diba, parang nag-build up siya, no? Parang yun.
Parang pang Dr. Love ba yan?
Dr. Love.
Talagang pang DJ na naiisip ko. Anyway, ano ba to? So you mentioned something about the frontliners and how they're coping. I'm sure everybody is also tired physically and mentally. Kasi hindi nila nakikita yung families because they have to be, isolated.
There's so much sacrifice. These frontliners are putting in. So they have to sacrifice their health, they have to sacrifice seeing their families.
Right.
They have, they don't have time na. Talagang napakalaking and like a lot of the hospitals are now full. And pati kahit na hindi kayo sa ER talaga
Exactly.
Kahit na sa regular wing ka, just because ang dami-daming pasyente talaga, pagod talaga yung mga frontliners natin.
Yes, and kudos to everybody. We salute you. You for protecting us, 'di ba? Yung mga taong nasa bahay. Sorry, nasa office kami ngayon. Pero hanggang dito lang naman kami. Hindi ko masyado maglililikot. We are praying for everybody also that they will be protected at saka yung biyayaan sila ng magandang pangatawan at saka clear mind to actually fulfill their duties as in the hospital. Pati yung ibang frontliners natin sa BPO, sa logistics, 'di ba? Yung mga naghahatid ng ating mga pagkain, yung mga backliners din natin, yung mga farmers, these are unheard heroes na nakaka-touch naman, 'di ba? Kapag naalala natin sila na sana yung mga ayan, katulad yan, may ambulansya sa labas.
Mga frontliners din yan. Kasi malapit tayo sa Mandaluyong tayo Kami-kami lang hospital
Yes. And they are, it's a regular thing that they roam around to check on people. If there are parang people on the streets, it's actually parang they're doing audits and it's also good.
Galing, diba? Pati mga janitors, di ba? Yan yung mahirap
masyado
napapansin.
Sila
linis ng linis to make sure that everything's disinfected.
And we all fear the unknown. Sabi nga ng lolo ko why do you fear the unknown? Just tama yung sinabi ni patient. Live, di ba? Continue to live. Kasi
to continue living. Just have to live it differently.
Tama. With that, Doktora, there's so much insights. No, what is that one major advice, or what's that one thing that you would like people who would like to follow your footsteps, diba? So you mentioned something about doing this thing for the patients. Medyo on call din si Doktora, diba? Even if it's telemedicine, diba, teleconsultation. It's still hard, especially kapag yung client mo, nakausap mo, tapos biglang may emergency, you have to drop everything and go. I mean, of course, Zoom muna, and then if ever talaga, you have to go to the hospital.
Yung referrals, those are the inpatients.
So what does, kung meron mang gusto mag-pursue ng career in psychiatry, what is that major advice that you can share sa mga nakikinig natin mga kids or mga aspiring mga
tama. We like
psychiatry.
Any advice or tip for those who would like to pursue psychiatry?
First and foremost, you have to be able to devote your time kasi super tagal yan you have like 4 years pre-med, you have 4 years med proper, you have like 1 year na board exam, you have 3 years ng residency. If you want to subspecialize, that's another 1 or 2 years. So that's easily more than 10 years of your life after you graduate from
Pero, Doktora, you are a fellow pa, so that's another year.
Plus, yung fellow kasi once
ang galing ni Doktora.
Once you have like served the association, then you can become a fellow.
That's nice.
So matagal
sobrang
yung
special.
subspecialty mo. So first, you have to have the devotion to the fields. You must want it enough to be able to devote, more than 10 years of your life. And that is a time na start kang kikita.
Exactly.
So, mayayaman na yung mga
Doon pa lang, after 10 years.
And of course, this is not, it's not surgical. So, don't expect na parang, you'll be earning as much as like maybe an interventional cardiologist is. So you have to have the passion for it. And talaga I went into medicine not knowing na I'm not going to go into any other specialty but psychiatry. Yun talaga yung interest.
Yun talaga yung gusto
from
mo.
the start. So you have to have the passion. Kasi if you're a psychiatrist kasi, you're not just taking care of the mind. It's always in psychiatry. Our perspective, it's always bio-psychosocial. So when you see your patients, you have to know, meron bang medical illness kung kaya nagkakaganon yung mga manifestations. You just don't say na, bigay ako ng gamot. It's not like that. And you have to see like what's happening to your patient, how your patient is like coping, and how is your patient being affected by all of these things in the environment. So dapat, nandun talaga yung malasakit mo para sa pasyente mo. So if you're just going to go there and prescribe medications, ay wag na lang, I can easily some nurse practitioner can probably do that, or kumuha ka lang reseta somewhere. So dapat yung malasakit mo for your patient should always be there. And ano pa ba? You should be able to draw your boundaries.
Yun!
Mahirap yan
Oo.
Day in, day out. Sometimes buong araw ka nakaupo dyan sa clinic. 8 hours.
8 hours.
Buong araw, you're just taking in. Medyo nakakapagod yun. So after that, you have to know how to draw the line. Otherwise, uwi mo siya lahat.
Exactly.
So you have to know kung alin to yung
Mabibitbit mo siya sa bahay, no?
Siya din-synthesize sa sarili mo, no?
Pero syempre may ibang patients, pag talaga medyo mahirap na cases, talaga mabibitbit mo yun kasi until you figure out like what to do.
Aaralin mo sila. Okay. Professor Sai, baka may tanong ka pa kay Doktora.
May gusto lang ako i-share kay Doktora. Meron kami ngayon na-discover na ng bagong technique na pinag-usapan namin ng wife ko. I don't know if it would help. Sabi pagdating ng 10 o'clock ng gabi, wala na pag-uusapan about work. Wala
Netflix
na manonood na lang kami ng Netflix or magbabasa na lang kami ng mga something like what we don't talk about business anymore. Kasi
salamat.
Pag pinag-usapan namin yung business, dugsong-dugsong, tapos bisa nagkakaroon ng anxiety kasi alam mo na may i-deliver ka na trabaho.
Totoo. Tapos hindi ka na makatulog, no? It's there
at
the back of your mind.
Ako naman, malamay Enriquez ako, hindi kita tatandaan.
Lalo nung tax season, Doktora, walang tulugan, literal, walang tulugan. Kasi kahit gusto mo siyang gawin na mas maaga, problema yung information, hindi kagad na ibibigay ng client. So you have to wait.
The government also, may mga
tapos
IT
may deadline din sa government na you have to comply. So yung office namin para nagiging secondary home na doktor ka matutulog kasi kailangan mo ayaw na namin magbitbit ng trabaho sa bahay kasi which is why nung tinanong ko yung anak ko, would you like to be an accountant? No. I don't want to bring work from to home. Diba?
Kasi nakikita sa adults di ba?
Nakikita kasi sa amin Tapos sabi ko, this is not healthy. This is not healthy.
And that's actually like a problem nitong mga work from homes, Ang daming mga...
You cannot define the line when you need to go to on a break, di ba? Exactly.
Wala nang linya ngayon kasi work from home.
Work from home.
Tama yung ginagawa ninyo. You have to have you have to have limits talaga.
So, pag 10 o'clock, bawal na pinag-uusapan ng trabaho.
Tama.
Pag-uusapan na natin, mag-chismisan na lang tayo.
Correct.
Or minsan nanonood na kami ng mga Tagalog movies na
nakakatuwa.
Pero tawa lang kami ng tao. Sabi ko, alam mo na gusto to, mami. Yung tatawa lang tayo kahit sabi mo, corny nung palabas. Meron ka lang talagang honest to goodness na tawa.
Totoo. Yung mga mababaw lang talaga, hindi ka talaga mag-iisip.
Totoo, mga slapstick na movie lang.
Actually, it helps.
Yeah.
And it will also help us, guys, they're listening to us right now, if you will kindly vote for if the topic is that we gave tonight is of value to you. Also, we would like to announce the winners. If you can read them, Professor Sai.
Chat box. Chat box na ba siya?
Yeah.
Teka,
Zoom.
wait lang. Sa Zoom, sa chat box. Teka ha. How about sa... Ito, Coach.
There. winners for tonight.
Teka, winners for tonight. Okay, wait lang medyo yung screen.
Ayan na, naka-post na.
Ikaw na lang.
Oh, sige, ako na. Okay. So we have AR Opao, Pearl Fats Lewis, Lori, Mary Joy Ramos, Joseph Nacionales Jr., Kanan Magalona, Jen De Ramos, Beth Canta, Edwin Alanigue, I hope I am able to pronounce it tama, Ravigil Hamtig. There you go, guys.
Okay, guys, congratulations.
Congratulations. Yeah. And before we, so that's the synthesis that we have for tonight, Prof. Sino. My takeaway really is to have boundaries. That's what I like what Dr. mentioned. So have boundaries, kahit naman sino, anything that's sobra is masama, di ba?
Totoo.
And then what's your key takeaway for tonight's session?
For one of the things that I like sinabi ni Doktora, sinabi niya, guys, ano ba yung normal, di ba? How do you actually define normal? You just have to continue living, but you have to live it differently with what we're having right now. And second, yung importante na if you are feeling something, talagang importante na kailangan sabihin mo, ikonsulta mo, di ba? It doesn't make you any different just because sinasabi mo siya. Di ba? Not until it's too late. Di ba, Coach, na kailangan babanggitin natin if we're feeling something na hindi normal or anything, kailangan banggitin mo And ako, for us, sa akin, kahit na sabihin mo corny as much as possible, corny siya or what, sabihin ko pa rin, bakit? Kasi it helps Marilib ka lang, like sinabi ni Doktora kanina, I like that sila mismo mga experts, medyo mga experts na pero magtatanungan pa rin sila.
Of course,
diba?
they still need a break.
Yes, they need a break.
Yes. And because of that, Doktora, may sumagot na ba sa trivia natin?
Sige, tingnan natin, Coach.
Okay, sasagutin na natin ang trivia. Okay, kunin ko lang yung script ko. Okay, the word quarantine comes from quarantena. Meaning 40 days. It is used in the 14th and 15th century Venetian and designating the period that all ships were required to be isolated before the passengers and crew could go ashore during the Black Death Plague epidemic. So, hindi lang nangyayari yung epidemic ngayon. So, before then, nangyari na yan, nakakaano lang kasi parang bumabalik, nagsacycle back.
History repeats itself. Iba lang yung branding niya ngayon.
Right. And also, it followed the Trentino or 30-day isolation period. Ang tagal. Ang isolation natin, di ba, usually 14 days lang. Dito, 30 days. 30-day isolation period. First imposed in 1347 in the Republic of Ragusa, Dalmacia. Saan yun? Mamaya. Titingnan ko sa mapa.
Sige, hanapin natin kasi meron tayong world map sa bahay.
Tama. Okay. So guys, I hope that you like our trivia for tonight. Yun pala, ang quarantine, it means 40 days. And isolation should be 30 days. Kulang pala ang ating tawag mo doon, yung 2 weeks quarantine period.
High-check naman na tayo ngayon, Coach.
Okay, sa bagay.
May science na yun sa atin ngayon.
May science na dati kasi kulang sa information.
Correct. And so with that, Dr. Lovie, thank you for your time and we hope that you and your team will be successful and will be able to help as many people pa din. Even if you are online, and especially those that you mentioned that are in the hospital, I hope they are safe and we will pray for everybody. Thank you for gracing our event.
Thank you so much, Doktora. We enjoyed this session.
I enjoyed being here also.
Ang ganda po ng topic natin. Very light.
Yeah.
It's timely and relevant to this epidemic. Ayan, guys. Thank you, Doktora. I hope this is not the last, diba? We would like to also salute all the frontliners that we know personally, our friends, and those that are in the States, yung mga relatives natin dyan. Shout out to my nurse cousins in Chicago and in Washington, D.C. and in California. Let me just greet Ate Alma She will be celebrating her birthday tomorrow, and she's a nurse in a home facility in California, Sacramento.
Picture.
Oh, okay, sige.
Yeah,
We will
picture tayo ng
have yes, our quick
Bilang ako
screenshot.
siya.
Okay.
Screenshot.
Okay, game. 1, 2, 3. All right. Thank you so much,
Doc,
guys.
thank you so much for your
Thank
time. I really
you.
appreciate it. Maraming salamat po.
Salamat
Ingat po
din
kayo
sa inyo.
and God
Kayo
bless.
rin, ha? Okay,
Yes,
take care.
Thank you.
Okay po. Thank
Bye-bye.
you. Thank you po.
Thank
Bye.
you. Yan. And now, guys, we have the following. We have the professors are what we look forward for you.
Okay, ladies and gentlemen, Coach, thank you so much for that.
Yes.
This coming August 23, we're going to have the master class together with Coach Ron C. and Coach Jeff Luz po on tax and estate planning. Okay, so this is going to be another fun and exciting session of learning and laughter. Yan, so alam mo naman when
Hi, Coach Ron.
Hi, Coach Ron.
Coach Jeff.
Coach Jeff, yan. Okay, and shout out din sa by the way, congratulations sa kanila for their training yesterday, last night, together with Coach Ava.
Yes, hi, Coach Ava.
And shout out
We
to
learned a
Coach
lot.
Brent. Coach Brent. Coach Brent.
Yes, Coach Brent.
Okay, yan. So, looking forward for it, guys. Kita-kita tayo.
Yeah, for me naman,
how about you,
I have our recap for the Kidpreneurship Batch 2, and that will be led by Janine Soberano. She will be teaching the kids on how to value money and how to manage it. It's this coming Saturday at 10 a.m. I hope the parents that are listening tonight can join that session. It's a very engaging and well attended by the kids. Your kids will be able to learn how to manage money. Anything else? Meron pa ba tayong Okay, next Sunday, our next speaker Sunday, yes, will be the owner of HLM Pharmacy, and he is Linley Rebuyon. Yan. Okay, opportunity amidst adversity, real talk with HLM's Linley. So, abangan yan. Okay?
Coach, excited ako dito kasi for one, the guy is really
inspiring.
Very inspiring self-made siya diba?
Yes.
From rags to riches talaga. Talagang dito mo makita the power of the human spirit. Yung grit na tinatawag, yung lagi mo sinasabi, grit, diba?
Oo.
Yun.
Yan.
So,
marami tayong matututunan dyan next
marami
Sunday.
tayong mga practical tips as a business person, as a professional, na matututunan
At saka sa pharmacy industry siya. Sa pharmacy industry.
Very timely, Coach.
Yes, and it's still part of our wellness month theme, diba, for August.
Right.
Yes, and aside from that, I would like you to also see this mini video clip from my advocacy, and this is by the PVMI sisters, and advocacy namin to dito sa XDT group. We help them build their home in Lipa, Batangas, where the novice from Asia will be housed in that area in Lipa. So we will show that next week. It's a video clip by the PVMI sisters. Hi, Sister Arlene and
Hi.
Sister Leah and the rest. There. Anything else for you, Prof. Sai?
Okay, I'm okay with it, Coach. Maraming salamat
Okay,
po.
with that, we would like to thank you, and I hope that you also still stay tuned for more, and abangan kami sa mga next appearances.
Next
Mga
episode
seminars,
natin,
yes.
especially next week.
Especially
it's going to be an
next week.
exciting topic, ladies and gentlemen.
Okay, and
Masaya po to.
we would like to cap this night over coffee. Until our next chat, guys. Bye.
Bye.
Good evening.